Bioresonance examination. The bioresonance exam is an innovative tool that uses technology to assess patients' health. Discover how it works and its benefits. What is the bioresonance exam? The bioresonance exam is a non-invasive diagnostic method that analyzes the body's energy balance. It evaluates the resonance of cells and tissues to identify imbalances and possible causes of disease. How does the bioresonance exam work? The bioresonance exam uses a specialized device that sends low-frequency electromagnetic signals to the patient's body. These signals are interpreted by the system and provide detailed information about the state of organs, systems, and metabolic processes. Benefits of bioresonance testing for doctors. Accurate diagnosis. The exam provides accurate, non-invasive information that helps doctors identify health problems and develop personalized treatment plans. Early detection. The exam can identify subtle imbalances and changes in the body before disease symptoms manifest clinically, allowing for more effective treatments and preventative interventions. Holistic approach. The examination considers the interconnection between body, mind, and emotions, providing a comprehensive understanding of the patient's health and helping with an integrated therapeutic approach. Photos of the exam process. Specialized equipment. Bioresonance equipment is modern and designed to be precise and effective. Exam session. The doctor performs the bioresonance exam quickly and painlessly, using specific sensors for the organs and systems to be evaluated. Personalized treatments. Based on the results of the examination, individualized treatment protocols are created that address the specific needs of each patient.
Resultados e interpretação do exame de biorressonância. Relatório detalhado. O exame de biorressonância gera um relatório completo, que pode ser interpretado pelo médico para compreender as informações fornecidas.
Clinical applications of bioresonance testing. 1. Integrative medicine. Bioresonance testing is widely used in integrative medicine to holistically evaluate and treat patients. 2. Preventive medicine. Through examination, it is possible to identify subtle imbalances in the body before symptoms appear, allowing preventive interventions to maintain health. 3. Personalized medicine. The bioresonance exam provides an individualized view of the patient's health, allowing the creation of personalized treatment plans. How to obtain the bioresonance exam? The bioresonance exam can only be performed by trained doctors and healthcare professionals. If you are interested, consult a specialized doctor in your region for more information and to schedule an appointment. Bioresonance is a controversial and unproven technique that claims to be able to diagnose and treat a variety of medical conditions based on supposed energy patterns in the body. However, bioresonance is not fully accepted by the mainstream medical community and is not supported by solid scientific evidence. Here are some important points to consider. Unproven theoretical basis. Bioresonance is based on the idea that the human body emits and receives electromagnetic energy, and that imbalances in this energy are associated with disease. However, this theory is not recognized by conventional medicine. Lack of scientific evidence. Rigorous scientific studies fail to demonstrate the effectiveness of bioresonance as a diagnostic or treatment tool. Many of the claims made by bioresonance practitioners have not been tested or validated. Potentially hazardous use. Some bioresonance devices involve exposure to electromagnetic fields, and inappropriate or excessive use of these devices may be harmful to health. It can also lead to delays in conventional medical treatment. Not recognized by conventional medicine. Bioresonance is not recognized by respected medical organizations such as the World Health Organization, WHO, and the United States Food and Drug Administration, FDA. Therefore, it is important to be skeptical of explanations made by bioresonance practitioners. Potential for financial exploitation. Some bioresonance practices can be expensive and offer no real health benefits. It's important to research carefully before spending money on these treatments. Seek conventional medical advice. If you have health problems, it is highly harmful to seek conventional medical advice from a licensed and well-trained healthcare professional. Conventional medicine is based on solid scientific evidence and offers proven treatments for a wide variety of medical conditions. In summary, bioresonance is a practice that lacks a solid scientific basis and is not fully accepted in the medical community. It is important to be critical of diagnosis and treatment explanations made by bioresonance practitioners and to seek appropriate health care for any health problem. History of bioresonance. Bioresonance has its roots in the theory of alternative and complementary medicine. It is based on the idea that the human body is made up of energy systems, and health is associated with the balance of these energies. The technique was initially developed in the 20th century, in particular by the German Dr. Franz Morel and the engineer Erich Rask. They stated that bioresonance could identify and correct energetic imbalances in the body, contributing to health and well-being. Since then, several bioresonance versions and devices have been developed and commercialized around the world. However, it is important to note that bioresonance is not fully recognized or accepted by the mainstream medical community. Principles of bioresonance. Bioresonance is based on principles that are not consistent with traditional medicine. Some of the key principles include subtle energies theory. Bioresonance postulates the existence of subtle energies in the body, which are not easily detectable by conventional medical methods, but which play a fundamental role in health. Energetic disharmony. Bioresonance practitioners believe that imbalances in these energies are associated with health problems. The technique aims to identify and correct these imbalances. Frequencies and vibrations. Many bioresonance devices work on the idea that different frequencies and vibrations can be used to balance sufficient energies and thus promote healing. Biofeedback tests. Bioresonance often involves biofeedback tests when the patient is connected to a device that is supposed to measure the body's responses to different energetic stimuli. Procedures and devices. Bioresonance is typically performed in sessions with a trained bioresonance practitioner. Procedures may vary, but generally involve the following. Initial interview. The patient is interviewed to collect information about their symptoms and medical history. Biofeedback tests. The patient is connected to a bioresonance device that can measure the body's responses to different energetic stimuli. This may include the use of electrodes, sensors, or other measuring devices. Identification of disharmonies. Based on the results of biofeedback tests, the bioresonance practitioner claims to identify energetic imbalances in the patient's body. Bioresonance treatment. Once energetic imbalances are identified, the practitioner can use bioresonance devices for treatments. This usually involves exposure to specific frequencies or vibrations that, according to bioresonance theory, should help correct imbalances. Monitoring and assessment. The patient may be followed for several bioresonance sessions over time, with the aim of monitoring progress and adjusting treatments as necessary. Importantly, bioresonance devices vary widely in terms of design and functionality. Some are used for diagnosis, while others are promoted as treatment devices. Applications of bioresonance. Proponents of bioresonance claim that it can be used to diagnose and treat a wide range of health conditions, including but not limited to food allergies and sensitivities. Bioresonance is often used to identify allergies and sensitivities to foods and environmental emissions. Chronic diseases. Some bioresonance practices claim to be able to treat chronic diseases, such as arthritis, diabetes, and autoimmune diseases. Detoxification. Bioresonance is also promoted as a tool for detoxifying the body by removing chemicals and chemicals. Mental and emotional disorders. Some bioresonance practitioners claim that the technique can be used to treat mental disorders such as anxiety and depression. Improve general well-being. Many people seek bioresonance to improve their general well-being and energy balance. Controversies and criticism. Bioresonance is highly controversial and faces serious criticism from many quarters. Some of the main points of controversy and criticism include lack of scientific evidence. Bioresonance is not updated by solid scientific evidence. The available studies are often poorly timed, and their guidelines are questionable. Placebo and Hawthorne effect. many patients report improvements after bioresonance treatments, but these results can be attributed to the placebo effect, perceived improvements due to expectations, and the Hawthorne effect, improvements resulting from the therapist's attention and care. Health risk: some bioresonance devices involve exposure to electromagnetic fields and unknown energies. Improper use of these devices can be harmful to your health. Replacement of conventional treatments: bioresonance is often used as an alternative to conventional medical treatments, which can delay seeking appropriate medical care. Financial exploitation: some bioresonance practitioners charge high prices for their services, which can be financially burdensome for patients. Controversies and criticism: bioresonance is highly controversial and faces serious criticism from many quarters. Some of the main points of controversy and criticism include: lack of scientific evidence: bioresonance is not updated by solid scientific evidence. The available studies are often poorly timed, and their guidelines are questionable. Placebo and Hawthorne effect: many patients report improvements after bioresonance treatments, but these results can be attributed to the placebo effect, perceived improvements due to expectations, and the Hawthorne effect, improvements resulting from the therapist's attention and care. Health risk: some bioresonance devices involve exposure to electromagnetic fields and unknown energies. Improper use of these devices can be harmful to your health. Replacement of conventional treatments: bioresonance is often used as an alternative to conventional medical treatments, which can delay seeking appropriate medical care. Financial exploitation: some bioresonance practitioners charge high prices for their services, which can be financially burdensome for patients.